Now, what I would like to do now is to walk through with you one specific program that is the collaboration between the academia and the community in providing youth-friendly sexual and reproductive health services. So this is a program that I'm also involved in. And really, this is bridging the ivory tower and, people on the street. And as we are all academics, we are researchers, and we do carry out research. And sometimes the research findings, we would really want to translate our findings into programs that would benefit the community. So what we have done here is that we engage the community into our program right from the planning until the outcome of the whole program. So here what we have is our target population, basically the adolescents, basically focus on adolescents, as we are very well aware adolescents and youth growing up in the urban underserved communities are very vulnerable to violence exposure and unsafe sexual activities. And here as well, sometimes they would have higher fertility rates than other youth urbanites, with young women at risk of having lesser education and autonomy, and they know very little about sexual and reproductive health services and very little access to them. And adolescents and young youth who are involved in a healthy relationship face risk of being exposed to the various psychological, physical, and sexual abuse. And adolescence, as we all know, is a transition period, a point of life where there is physical, biological, and hormonal changes, and an age where the individual would want to obtain stable, independent role in the society. In this particular project that we have, we focus on gender-based violence and risky behavior sexual among the urban poor youth. All these are emerging public health issues that we are facing, and youth has difficulty in accessing healthcare services due to lack of health literacy, and health service providers are likely to be unsensitized and unable to meet needs of youth health issues. And youth do not exist in silo, and thus a multi-agency collaboration approach is warranted to effectively build youth health literacy to increase their access to health services. Now, our approach here in developing this is based on social ecological theory here. And the social ecological theory, it's a theory-based framework for understanding the multifaceted and interactive effects of the personal and environmental factors that determines behavior, and for identifying behavior and organizational leverage points and intermediaries for health promotion within the organization itself. And they are all, hierarchical levels of the social ecological model: the individual, as you can see here, the relationship, and the community involvement, and the society. As for the individual, you have individual factors, relationship factors, and the society, the neighborhood factors, and of course the social and society factors as well. And so the most effective approach to public health prevention and control, I think, utilizes a combination of intervention at all levels of this model. Now, this is a social ecological theory, a different level. The individual level looks into the characteristics of an individual that influence behavioral change, including knowledge, attitudes, behavior, self-efficacy, developmental history, your gender, age, religious identity, your values, your goals, literacy, stigma, and others. And what about interpersonal level? That's the formal and informal social network and social support system that can influence individual behaviors such as the family, friends, peers, co-workers, religious network, customs, or traditions. Moving on, it's the community level. we are looking at relationship among organizations, among institutions, and informational network within defined boundaries, including the built environment, village associations, community leaders, businesses, and transportation. And what about the organizational level? Of social institutions with rules and regulations for operations that affect how and how well, for example, maternal child health services are provided to an individual or to the community or to a group. And at the policy level as well, we have the local, state, national, global laws and policies that we need to adhere to, including policies, allocation of resources for materials, newborn child health, access to healthcare, lack of policies that require childhood immunization, for instance. So this is the socio-ecological theory that drives, this whole program that we have embarked on. Now, coming back to adolescent girls who experience physical and social dating violence were 6 times more likely to become pregnant than their non-abuse peers. And this perhaps one of the justification as to why our program focuses on adolescents. And of course, with adolescent unintended pregnancy, what we have is, the consequences will be anemia, preterm delivery, low birth weight, and neonatal mortality. So these are some of the negative health outcomes of adolescent unintended or unwanted pregnancy. And because of this, we then lead on to knowledge transfer program. So this is an example of knowledge transfer, KT, involving various partners, both at a micro level and a macro level. And here we have the health literacy intervention in an urban poor community to strategic collaboration with various agencies, including universities, the health clinic, and with an NGO as well. And the NGO that we work with is called AWAN, the All Women Action Society movement. Right. This is our strategic partnership. We have, it's a combination of various organizations. Our organization, University of Malaya, we have, I think, other universities, University of Technology, Mara. We have the Ministry of Health, and also we have the Ministry of Women, Family and Community, and the NGO All Women Action Society. We look more into preventive effort and in terms of handling and addressing the sexual and reproductive health issues of the adolescent and the youth in that particular community. And so this, the involvement of university, the health center situated in that particular community itself, role of NGO, and under the Ministry of Women and Family Affairs, we have the Department of Social Welfare, that actually helps us. So the objective of this community academic partnership is that we hope to improve youth awareness on gender-based violence and sexual and reproductive health, and also to establish the youth leaders, providing them a peer education, and also to establish networks towards intervention of gender-based violence and teen pregnancy. And so it's very important for us to work with other agencies as well, other stakeholders. And so the community involvement is indeed important for us.